All right, y'all. All power to the people. It's your comrade Garlic back again. It's kind of cold outside. Got my overalls on. So for today, I'm going to be reading an essay by Comrade Pitt, who's our Minister of Information, currently incarcerated at Red Onion in Virginia. He wrote this essay called "The Vulnerability of Prisons Amongst the Global Health Crisis." He wrote it a little bit ago. Sent it to me in the mail, so it's handwritten. The numbers are a little off because of the dating of it, because a lot has transpired since I'm reading this. But I wanted to get it out in an audio form, audio video for y'all. So let's just get right into it. The vulnerability of prisoners amongst a global health crisis. With the rapid outbreak of COVID-19 pandemic, life as people know it has been altered. Nations placed on virtual lockdowns, sports events canceled, school closures, ban on mass gatherings and unessential travels, etc. This outbreak is deemed to be greater than the 1918 so-called Spanish flu, SARS epidemic, bird flu, and swine flu if vaccine isn't quickly developed. In mere months, COVID-19 managed to reach every corner of the world. To illustrate how fast it spread, March 8th, there were 500 confirmed cases in the US. That number skyrocketed to over 3,000 in just a week and currently stands at over 300,000 with over 1,000 deaths. Hospitals have been overwhelmed and pushed past their capacity. The shortage of personal protective equipment, PPE, and ventilators only exacerbates what's already a global health crisis. At the time of this writing, there are over 2,000 confirmed cases of COVID-19 and 60 deaths in the state of Virginia. At the rate of this virus is spreading, it would eventually affect a large percentage of the population in society and prisons. I'll focus on the latter. Virginia, like other states, declared a state of emergency after cases of COVID-19 were discovered. Virginia Department of Corrections suspended all visits from prisoners' families, friends, and attorneys until further notice, an obvious attempt to prevent COVID-19 from entering its prisons. A memorandum was subsequently distributed explaining that the virus is and issued precautionary methods on the best way to avoid contracting this virus, such as frequent hand wash, avoiding touching the eyes, nose, and mouth, and it was also suggested to practice social distancing, standing 6 feet away from others. These are guidelines established by the Center for Disease Control and Prevention and adopted by the Virginia Department of Corrections, as I'm sure by other state prisons as well. This notion of social distancing in a prison setting is utterly impossible for a number of reasons. Many of those in general population have roommates, walk to chow hall with others, attend school, program, and gym together, religious services, outside and pod recreation, etc. All of these are activities conducted in large gatherings. Whereas those in solitary confinement, though they don't participate in such gatherings, it requires they be restrained and escorted by 2 guards anytime they step out of the cell for any reason. This point being close contact is inevitable whether one is in general population or solitary confinement. Despite the VDOC efforts to prevent this virus from entering its prisons by temporarily suspending visits, judging by the trend on how rapid it spreads, it seems bound to make its way into prisons. Indeed, this is a peculiar situation since there's no foolproof way to prevent it from coming in. It's easy to predict how fast it will spread due to aforementioned reasons. The close proximity prisoners live under and taking into account other relevant factors such as we use the same phones, JPay kiosks, same recreation equipment, guards using the same restraints on prisoners, etc. The conditions are ripe for a massive outbreak. In an unprecedented case of transparency, VDOC issued another memorandum on updates of the COVID-19 virus, which in summary stated that March 18th, 2020, a dozen inmates at Coffeewood Corrections had fever and 2 tested positive for the flu. All were housed in the same unit. The Virginia Department of Health was notified and they were quarantined awaiting the testing of COVID-19. This highlights just another issue. The testing of this virus has been a major issue for those in society, so much so that the government keeps reiterating that the test kits are in short supply and adopted a priority list of who should get tested. Suffice to say, it's not exactly far-fetched, inconceivable assumption that prisoners are not on this priority list, no matter how ill they get. One of the many things I've learned about prisons' function is that oftentimes prison officials have the propensity to be reactive rather than proactive, reading they wait for something to happen, then structure a policy around it. The best thing for prisoners to do is not to wait to see what prison officials will or won't do. We can take the initiative ourselves in protecting our own health by adhering to the CDC guidelines, by washing hands often, cover mouth when coughing, avoid touching eyes, nose, and mouth, and take any preventative measure we feel will keep us safe. With hospitals being overwhelmed, many of them lacking necessary medical equipment to combat this virus, such as not enough ventilators, masks, gloves, gowns, healthcare workers having to refuse protective gears they'd otherwise discard after single use. Obviously, prison medical units aren't prepared, let alone equipped to respond to an outbreak of COVID-19. Let's take any and all preventative measure of ensuring we don't contract or pass on this virus to others. We are in a uniquely vulnerable situation, whether in society and especially those in prison, but we'll be all right. All power to the people, Panther love. And if y'all want to write to Comrade Pitt, his information is Peter Kamau, Kamau, Mukuria, Mukuria. His number is 1197165 at Red Onion State Prison, P.O. Box 1900, pound, Pound, Virginia 24279. And there's a note at the end that says the VDOC has since distributed 2 sneeze guards to prisoners, which both staff and prisoners are mandated to wear. All right, all power to the people. Just wanted to read that to you guys just to kind of highlight the situations that are happening in prisons at the moment. This is just a small example that a lot of prisoners are facing right now, and stuff that as revolutionaries we really need to push and advocate for, honestly, the release of prisoners with a dedicated plan to house these prisoners after the fact, because we release them, you know, like where are we releasing them to? Their family. Currently, the United Panther movement is doing an ongoing campaign to call all 50 governors, all the states, to demand a list. We've got a script. If you need to see it, you can check out the prison committee Twitter. That was a lot of information posted there. Also, it'll be posted by the New African Black Panther Party Twitter and the United Panther Movement Twitter as well. All right, this is Comrade Garlic. I'm out. All power to the people.